February 2017 ngutilugo Bernice Clark uqawsaqarluni anaanamini inuyunnilartillugu uqaruorto inuktugu atuutiqarayalortu uumanayaqqulortugu inuktu atuqtoyunnalorpan inuktu piirsiqtauvaraungimman puvaglukluni inuyunniilortu tingunga pijjutigillugu aaduaamin March 2017 ngutillugu Gila Kunilusi aperiyauluni paningmini qanoilormanga Eileen inuyunniilortillugu 15 ni aqraaguqartillugu uqaloortu piirsiqtauyunnaqattilortaq guuq inuktut akaunerlaunayalortu In February 2017, Bernice Clark, in speaking about the death of her mother, Annie Kutu, stated that Inuktitut may have made a difference for her mother. She had not received health services in Inuktitut. She was being treated for tuberculosis and she died in Ottawa of liver failure. In March 2017, when Gila Kunilusi was asked about her daughter Eileen, who died at the age of 15, what needs to prevent another death like her daughter's, she responded that health centers need Inuit staff who speak Inuktitut. Today, I want to speak to you about Inuktitut as a public health issue. I'm very pleased that the National Collaborating Center for Aboriginal Health is focusing this webinar on today's topic, Indigenous Languages Determining Public Health Outcomes in Canada. Given the many statistics indicating the lower health status of many Inuit compared to the average Canadian and the higher rates of preventable diseases and other medical ailments amongst Inuit, this may seem like an unlikely topic to focus on, but like Bernice and like Gila, I think it is an important topic that is worth thinking more deeply about. Our 2007-2008 annual report on Nunavut's health system states, and I quote, Inuit are emerging from a period when healthcare priorities and most aspects of healthcare practice and delivery were set by non-Inuit. Inuit wish to improve upon the conventional medical system in Nunavut. It does not engage Inuit, does not operate in Inuit language, does not employ Inuit at a representational level, and does not adequately acknowledge Inuit healers or healing practices. Poorly adapted and chronically underfunded healthcare services and programs based in southern Canada and delivered primarily in English are no longer acceptable. End quote. As quoted from the Commonwealth Fund and used on the cover of the Systemic Investigation Report into the Piikistani General Hospital's compliance with the Official Languages Act and by the Office of the Languages Commission of Nunavut in October 2015, quote, being able to speak in one's mother tongue when it concerns health is not asking a favor of healthcare professionals or organizations. On the contrary, it is a basic issue of accessibility, safety, quality, and equality of services. Before I delve right into this topic, for those of you who have not had the great fortune to come to Nunavut, I thought I would provide you with a broad context. First, Nunavut in Inuktitut means our land. My name is Aluki Kotierk, and I'm the president of Nunavut Tungavik Incorporated, NTI for short. NTI is the Inuit organization that represents Nunavut Inuit. Nunavut Inuit make up 85% of the population of Nunavut. 70% identify Inuktitut as their mother tongue. There are 25 communities spread across this vast land that make up 1/5 of Canada's landmass. These 25 communities receive healthcare services through 22 community health centers, regional health centers in Rankin Inlet, Cambridge Bay, and the Piikistani General Hospital in Établissement. Depending on a patient's needs and the types of level of care available in a community, patients may be sent to larger centers for treatment of condition. In 2015-2016, just over $70 million was spent on medical travel. That was 16.7% of the whole total Department of Health expenditures. Community health centers are typically staffed by nurse in charge and a community health nurses. As of March 31st, 2016, 43 of the 69 community health nurses positions were vacant at 62%. 5 of the 25 nurse-in-charge positions were vacant, 20%. Casual and agency nurses are used to fill these vacancies and to replace permanent nurses on leave. During 2015 and 2016, a little over $30 million was spent on casual and agency nurses. Each of our communities has schools up to grade 12. There is a Nunavut Arctic College which has learning centers in each community. There is no university in Nunavut. Across the Nunavut, there are 42 schools plus 1 French school. 37 of the 42 school principals are non-Inuit. There are 9,300 Inuit students and 430 non-Inuit students enrolled in the Nunavut schools. There are 125 Inuktitut-speaking Inuit teachers and 453 non-Inuktitut-speaking non-Inuit teachers. An Inuktitut-speaking student in grade 9, for instance, when they attend the school, are unable to speak Inuktitut because there's not enough Inuktitut-speaking teachers, nor are they learning from culturally appropriate curricula with culturally appropriate resources and materials. Sometimes I wonder how different our current school system is that to the residential schools, when the end result is often similar and children continue to be stripped of their identity and language. Across Canada, our language, Inuktitut, is considered to be one of the stronger Indigenous languages. You will recall one of the slides that Lorena shared in terms of Inuktitut speakers. Yet, we know it is declining at 1% per year. At this rate, by 2051, only 4% of us will be speaking Inuktitut at home. Nunavut is the only jurisdiction in Canada that has a majority language that is not one of the federally recognized official languages, French or English. Despite this, Inuktitut is not the working language of government, nor the language used to provide essential services. This concerns me. It concerns me that some unilingual Inuktitut-speaking Inuit are not receiving equitable public services similar to those of other Canadians. Historically, we know that Canada funded buildings and personnel to actively strip Indigenous people of their culture, including their language, through residential school. In my view, Canada should and has the responsibility to fund buildings and personnel to actively rebuild, strengthen, and protect Indigenous languages. I'd like to ask you to take a moment to think about your last trip to the doctor or to the hospital. How important is communication to you? How important is language to communicating to your doctor or nurse? Think about your doctor's visit. How big a role did accurate communication and understanding play in what type of health treatment you received? Pretty big, right? So imagine living in Toronto, where the majority public language is English. Now imagine that almost none of the healthcare professionals speak or understand that majority language. How would you feel going into that system? That is our reality. And I did not even ask you to imagine the next step, where you needed the expertise of a doctor or services only a hospital could deliver, and you had to fly, often unaccompanied, as far away as Mexico. Some of the findings of the systemic investigation included language barriers have a negative impact on quality of care, patient safety, and access to healthcare services. Patient-provider communication problems may result in a misdiagnosis and irrelevant follow-up treatment. Patient confidentiality rights and informed consent may not be protected. In speaking about interpretation services, one of the contributors stated, and I quote, "The worst case I saw is that we had to use other patients as interpreters. Obviously, it is a breach of confidentiality, but I also feel that if I use a patient to translate for another patient, it transgresses medical rights. You are here to get better, and you are being used as staff. Sometimes the patient has to give it a try, but it is the best solution we can come up with. In Nunavut, we Inuit live under a public government, just like Ontario or Quebec. We pay income tax. We expect to receive public services just like other Canadians. We want to feel safe when we enter the health system, the school system, the justice system. Do we feel safe? I think not. What's the difference? The difference is our majority public language is Inuktitut. What happens when the government does not deliver public services in the language of the public? Canadians die. Canadians are hurt. This happens in Nunavut. Would this be allowed to happen in Vancouver or Montreal? This is a public safety issue. 2018 marks 25 years since Nunavut Inuit achieved a land claims agreement with the Crown. 2019 marks 20 years since the creation of the Nunavut territory. It is a good time to reflect on where we are. Is this what Nunavut Inuit envisioned when they tirelessly negotiated the land claims agreement? Where would we like to see ourselves in the next 20, 25 years? How can we make life better for our children and their children? When the Government of Canada and the Government of Northwest Territories met 20 years ago to decide how to fund the Nunavut public government and public services, they decided not to fund Inuktitut as the language of our government. This was a decision. It was not an accident. It was not an oversight. Inuit experienced the results of this decision. The results are that we have a health system that does not function in the majority public language, a justice system that does not function in the majority public language, and an education system that does not function in the majority public language. As we enter into 2019, the International Year of Indigenous Languages, with the federal government committed to a National First Nations, Inuit, and Métis Languages Act, in the wake of the 20th anniversary of the creation of the Nunavut Territory, I see a great opportunity to reverse a decision that was made 20 years ago. The timing is right to fully resource and support Inuktitut as the working language of Nunavut, spoken by the public majority population of Nunavut. If committed to, this truly would be a move towards reconciliation. Inuit are resilient, adaptable, and pragmatic. So we cope, we cooperate, and we communicate. We do what the public services have chosen not to do. We keep our language alive at home. We translate for our relatives in the health system. Every day, in hundreds of interactions with public services, we help our relatives and community members communicate. I do this. My relatives do this. This is our reality as Inuktitut-speaking residents of Nunavut. Often, informal interpretation services are provided on top of one's own employment and community responsibilities. In my role, I travel quite frequently. One day, I was trying to check in at the Iqaluit airport for my own flight, and an employee of an airline at the counter gestured me over to help them speak to a unilingual Inuktitut-speaking passenger. This is in Nunavut, in our homeland, where the majority public language is Inuktitut. Providing informal interpretations is an additional burden of being an Inuktitut-speaking Inuk living in Nunavut that is hardly ever acknowledged and recognized, but is so very readily expected and undeniably necessary. Just because an Inuk is fluent in Inuktitut, the assumption is made that an Inuk will be able to effectively and accurately interpret any discussion, even if it has complex technical vocabulary that one has never spoken about in one's personal life. I often wonder what it would have been like if there had been a decision made to fund Inuktitut as the working language of our government. If Inuktitut was the working language of the Nunavut territory, the majority public population of Inuit would be able to receive Inuktitut essential public services. This would include receiving healthcare services in Inuktitut. It would include receiving banking services in Inuktitut. It would include receiving services from the justice system in Inuktitut. It would include going to school in Inuktitut. Basically, it would mean that Nunavut Inuit would be able to receive any day-to-day services that other Canadians enjoy in Inuktitut, a language that many Inuits still prefer to use. To take it a step further, it would mean that the public system would provide consistent and important messaging to Inuit that their language is important, that their worldview is important, that their existence is important. This would have a positive and lasting impact on Inuit identity, on Inuit mental health, on Inuit self-worth, because the public environment, instead of marginalizing Inuit and Inuktitut, would be affirming and rebuilding Inuit and Inuktitut. I want to take a second to dwell on how informal interpretation is expected. Imagine, for instance, if in the airport scenario, although being gestured over by a person that I do not work with, by a person I do not associate with, I had said no. I was not willing to help the airline employee communicate with their passenger. The airline employee would probably be offended and think that I have an attitude and that I was being difficult. The unilingual Inuktitut speaking person would probably wonder what kind of an Inuk I was. As Inuit, we are brought up to be helpful, contributing members of society. I would be left feeling guilty and thinking that I was a bad Inuk for not helping out a fellow Inuk. This is another way of maintaining the power imbalance and accepting things that are unacceptable. Imagine if French, an official language of this nation, had been expected to thrive through the goodness of people's hearts. Anecdotally, to bring it back to the health field, I have heard that Inuktitut-speaking nursing students are expected to step up without the additional supports of Inuktitut medical terminology when they are doing their practicum at the hospital. Think about the additional stress that is not placed on non-Inuktitut-speaking, mostly non-Inuit students. And then the system wonders why Inuit are sometimes less successful. The March 2017 OAG report on health services in Nunavut found that there is a non-mandatory course on medical terminology available for clerk interpreters. Yet the clerk interpreters that they had met had not received such training, had not received it in a timely manner, or had not taken training in many years. It stated, and I quote, "Having interpreters with knowledge of medical terminology and vocabulary is important because it helps Inuit patients who do not speak English and their healthcare providers better understand each other. For example, the patient's condition." One of the recommendations coming out of the systemic investigation was the Department of Health, in collaboration with Inuit Housing and Nitego should develop competency tools to evaluate language proficiency of medical interpreters. Too often, when an Inuktitut-speaking patient walks into the healthcare system or healthcare center in Nunavut, they must revert to speaking in English to receive essential health services, even if they are more comfortable in speaking Inuktitut. Again, from the systemic investigation, it states, what medical providers must understand is that when one is placed in a situation of vulnerability, it is often difficult to understand medical jargon and to clearly express one's needs, fear, pain, etc. It is even more difficult to express these concepts in a language that is not one's own. This is recognized and most recently expressed in the coroner's report surrounding the circumstances of the death of Annie Kutu. The report had two recommendations that highlight the need to use Inuktitut interpreters when providing health teaching, as well as the need to provide written instructions in Inuktitut. I have spent much of my talk on language and culturally appropriate health service delivery. I think I also need to speak to the importance of having a trauma-informed approach to health services. It is important for any health worker going into our communities to have a general understanding of the types of lived experiences, social history, and intergenerational trauma that Inuit carry. In Nunavut, it is in living history that our family members were living out on the land. It is quite recent that the 25 communities were established. Before that, Inuit lived as masters of their own destiny in family groupings in a nomadic lifestyle. When communities were being established, Kadlunan, or non-Inuit, would come to our lands in authoritative positions. Life was disrupted and changed forever. During this period, there was an increase in tuberculosis, as documented in the Kikitani Truth Commission report on healthcare. By 1955, almost 1,000 Inuit had been evacuated to southern sanatoria. Treatment generally averaged 20 months. This meant that in 1956, 1 in 7 Inuit were in hospitals in the South. This has an impact on Inuit living today who still carry pain and heartaches about this era. Some Inuit still do not know where their family members were and where their remains are. An Inuk TB patient at a southern sanatorium at the time wrote, "I really do want to go home. I do want to stay outside, and I cannot tell you about my health as I am not able to understand English. I am obeying the medical staff. I take aspirin. It is hard to tell. Also, I cannot cure myself. I very much want to speak English. I am trying to obey the directions of the medical people. I want to go home too. Sometimes I appear not to be listening. I want to follow the wishes of the medical people. I, however, do not understand." It is important that healthcare professionals understand the context and the reasons behind some of the stigma that exists, for instance, in the circumstances of tuberculosis. This type of stigma, I would point out, sometimes exists about sending children to school. In my view, public systems such as the healthcare system or the school system can play an important role in reconciliation with Indigenous peoples across this nation. In my view, the Nunavut healthcare system and the Nunavut education system can play a significant leadership role in achieving reconciliation with Inuit. For me, reconciliation includes bringing back dignity to a people. NTI's 2009 annual report on the recruitment and retention of Inuit nurses in Nunavut states, "Linguistic and cultural barriers separate healthcare providers from patients. These barriers can lead to incomplete or incorrect diagnosis and treatment of health problems due to healthcare providers' limited understanding of what a patient says." One informant noted that Southern public health strategies tend to rely upon printed materials and provision of readings, resources, and web-based information. In Northern communities, the most effective communication is verbal and one-on-one. This approach, however, requires both fluency in the patient's language and familiarity with culturally relevant communication styles. Many Inuit have little faith in the current health service delivery model, and to a certain degree in the staff of healthcare centers. There is a sense that their needs are not well understood at the community level and that the communication gap is even greater when they are forced to travel to regional centers for care. For communities such as Rankin Inlet, with a relatively high proportion of Inuit nurses, 5 out of a total of 7, informants reported a very positive impact on the impressions of Inuit patients who have been able to access health care in their own language. Several informants noted that the presence of Inuit nurses on staff reduces much of the stress experienced by non-Inuit full-time nurses. In the Truth and Reconciliation Commission calls to action under the heading of health, there are 7 calls to action. I want to draw your attention to call to action 23. It states, "We call upon all levels of government to increase the number of Aboriginal professionals working in the healthcare field, ensure the retention of Aboriginal healthcare providers in Aboriginal communities, provide culturally competency training for all healthcare professionals." This is so crucially important that at NTI's annual general meeting in 2006, the membership put forward a resolution calling on the government of Nunavut to implement robust and creative measures to increase the number of Inuit primary healthcare professionals in Nunavut, to actively encourage and adequately support the successful completion of Inuit students attending the nursing program offered by Nunavut Arctic College, to evaluate the Department of Health's efforts to increase recruitment and retention of Inuit nurses. Within Nunavut, the Nunavut Arctic College has a nursing program with the intention of being a space in which homegrown Inuit-speaking nurses can attain their accreditation. In February 2018, through the Northern Ontario School of Medicine, the first Health Careers Camp was held in Iqaluit for Inuit high school students. This was a week-long camp that allowed students the opportunity to hear firsthand from individuals, including Inuit, in the healthcare field. They were able to try on activities such as setting a cast, going to the laboratory, speaking with an elder about traditional medical treatments, going to the hospital, etc. The hope is that camps such as these would pique the interest of young Inuit to pursue health careers. At the basis of all this, I would argue, is the need to have an Inuit school system supported through culturally appropriate curricula, resources, and materials. We urgently need to ensure that the school system, instead of being a subtractive system, is a reaffirming and supportive system for Inuit children to thrive and successfully transition into adult life and becoming positive contributing members of society. Although there is a great improvement required and much work to be done to achieve our expectations, I would be remiss in not taking this opportunity to express how extremely proud I am with the Nunavut Inuit who have successfully completed medical school. Elaine Kilabak was the first Inuk physician to graduate from McGill University. She was inspired to take up medicine after she watched what her grandmother had to go through when she had a respiratory illness, and she had to be moved from Pangnakto to Iqaluit and then to Ottawa, without culturally sensitive health care. I'm very pleased that her intentions are to provide health care services in Iqaluit. Donna May Kimalerjuk is the first Inuk heart surgeon. She is currently in her 4th year of residency at the University of Ottawa. These are some successes and positive initiatives, but certainly there is much work that still needs to be done in areas of student support for success, medical terminology development, filling vacancies, Inuit nurse supports, and medical clerk interpreter support. I would also add that as Inuktitut speakers, we also have a responsibility to request services in Inuktitut, rather than continuing our approach to reverting to speaking English. The more we demand services in Inuktitut, surely government systems will get the message that we need and expect services in Inuktitut. I invite each of you, in whatever capacity you are participating in the webinar, to think about how you can create more space for the use of Indigenous languages. I look forward to a day in which an Inuktitut-speaking Inuk living in Nunavut can walk into a health center or the Kikatani General Hospital with the self-assuredness that they would be able to receive the health care service in Inuktitut. I look forward to the day in which an Inuktitut-speaking Inuk living in Nunavut can walk into a local school and complete formal education in Inuktitut using culturally appropriate curricula and materials. I look forward to the day in which I can see more Inuit walking within Nunavut in our own homelands with their heads held up high, proud to be Inuit with dignity and without shame, knowing that they too can receive services in Inuktitut. Kuya Namig, that concludes my presentation.